Hey, Dr. Dennis, I have a question for you. What's a root canal?
A root canal is when we go inside of the tooth and clean out the nerve and the blood inside of the tooth to get rid of pain or infection. There are a variety of reasons that you need a root canal, but removing that nerve inside of the tooth relieves that pain.
Why can't I just get a crown? And do I really need an injection?
The necessity for a root canal is not just what you see on the outside. If you think about the hole that you have on your tooth, oftentimes when you need a root canal, if we just covered that up without addressing what's going on inside, you would still have pain. So the root canal is a portion of the root that's underneath the gum. So we need to not only take care of what it looks like from the outside, but we have to clean out the inside of the tooth of infection, of things that are growing inside that are causing you pain, so that we can address the issue. Just covering the tooth in the case where you need a root canal is just not enough.
Still not clear. What are the reasons I need a root canal?
There are a lot of reasons that someone will need a root canal. Let's go through a couple of them. One of the reasons that, or one of the most often reasons I see that people need a root canal is that they have a cavity that grows and goes untreated. The cavity goes into the enamel, down through the dentin, into the nerve. And when it goes into the nerve, it causes pain. If that cavity does not get addressed at that point, then it can cause an infection. Sometimes that infection is as simple as some sensitivity with hot, cold, sweet, sometimes bite, and sometimes that causes an abscess that swells up your face. Sometimes the infection will look like a pimple on your gum that we call a fistula, or I see people all the time, the face is completely swollen. So in a root canal, that's one of the main reasons. Cavity grows inside of the tooth, causes an infection. One of the other reasons that people need a root canal is sometimes the tooth will break, and depending on how the tooth breaks and it's painful, we need to remove the nerve in order to make that feel better. Another reason that people sometimes need root canals is if they have trauma. Now, trauma is a little funny because I see people all the time that got a tooth hit, especially in the front. Maybe when they were a child playing soccer, playing basketball, playing any kind of sports, and then over time the tooth started to change color and it will get dark. I've seen it even turn blue, brown. It looks just different. The tooth is dying on the inside, and once it's dead on the inside, it gets what we call necrotic tissue. It's dead on the inside, so we have to go in with the root canal, clean it out. That can also cause infection, swelling, those sorts of things. So root canals can be done for a lot of different reasons. Those are not the only reasons that root canals need to be done, but those are the ones that are the most common reasons.
Does this procedure hurt?
A root canal, like every other dental procedure that we do, starts off with getting you numb. Of course, I do not enjoy my patients to be in pain. However, that's why we use dental anesthesia, and the dental anesthesia is going to numb the tooth so that while we're doing the root canal that you don't have pain. That's the same thing that goes for extractions. That's the same thing that goes for fillings. That's the same thing that goes for implants. We got to get you numb. If we don't get you numb, of course it's going to hurt. The whole point is to get you happier and more comfortable. I will tell you this, the longer that you wait to get a root canal, if you need one, that infection starts to counteract the anesthetic. So you want to get in right away. You don't want your face to get big. You don't want to need antibiotics first and those sorts of things, because that adds to your pain. If you're not sleeping at night, you probably need a root canal. If you can't enjoy your food, we can talk about what your symptoms are, but pain is going to be better after, because we're not really concerned about whatever pain, even though I don't want you to have any in the dental chair. We want you to go home feeling better.
Okay, so now you're telling me I need a crown after a root canal?
The reason it's important to crown your tooth after having a root canal is because simply we don't want it to break. Most people who had a root canal already started off with a very large hole. And we've talked about this in our other videos. When you already have very little tooth left, You need something to protect it from breaking. So number one, you already had a big hole, so we got to cover the tooth up. We got to make it look good again. The second reason is, again, if we take that nerve out, we take that blood out of that tooth is breaking very easy. It's most people who break a tooth after they've had a root canal, it's not because they were chewing something hard like ice or chicken bone. Most of the time, they broke it on something soft. I cannot tell you how many times someone would say, I was having oatmeal, I was having bread, and my tooth just crumbled. I was having a chicken tender. It doesn't take much to break that kind of tooth. Your molars especially are meant for chewing, and once you take that initial bite and you put that food in the back, once it starts that chewing, if there's not strong tooth structure to chew with, that tooth is going to break, especially with a root canal. So I wouldn't take the chance. Once you've invested your money into doing a root canal to save that tooth, protect it, because if you do not, you will end up having that tooth broken. We will have to pull or extract the tooth, and then after that you're going to need an implant. So it's not to say implants are bad. However, if you can avoid having more procedures done, just cover the tooth up. It makes a world of difference.
Okay, Dr. Dennis, you've been very helpful.